My name is Marcia Kimeldorf. I am a clinical psychologist, and I am the project manager here on the OCD and related disorders research team here at the New York State Psychiatric Institute at Columbia University. In that role, I do a variety of things. I speak with a lot of patients, potential patients, people looking for referrals out in the community, and mostly what I try to do from a recruitment perspective is bring on in folks who we might be able to help through some of our treatment research studies and our investigational research studies. What I do involves assessing patients here. So when patients come in, I help determine whether they're going to be eligible for any of the research studies that we have going on by doing psychiatric intake evaluations with them, describing our studies, making sure everybody's aware of what it means to be in research and that they are consenting to participate. And the research that we do here is really exciting. We have a whole bunch of different studies going on. Some of them are investigating the underlying brain basis of OCD and what contributes to anxiety disorders. Some of them are more treatment focused, and some are sort of a combination of that. One study that I am the project manager for actually looks across a variety of different psychiatric illnesses. One, social anxiety, another obsessive-compulsive disorder, and a third is anorexia nervosa. And for that study, we're looking at underlying brain differences in neurocircuitry. I've always been interested in people, and I chose to be a clinical psychologist so that I could help people more broadly through more personal understanding of what it is that they're going through. And so I am lucky to be able to see people in a research context here where I evaluate them and try to provide help for them through finding appropriate research studies or other resources for them. And I also have a private practice where I get to one-on-one do therapy with folks struggling with anxiety disorders and relationship dysfunction issues and things like that. And I find this to be the most rewarding possible career. I mean, you really get to touch the lives of people and alleviate suffering when you can. Some of the most rewarding things are when somebody on the phone, even if they're not going to be eligible or interested in doing research, says, "Thank you so much, you've actually listened to me. You've actually taken the time to understand what's troubling me or affecting my son or daughter or family member. And I really appreciate that you've taken the time to listen," and I love when I can do that for people. I also love when people come on in and I get to, what I'm doing is figuring out if they're eligible for the studies and what we can do, where we can find a place to put them. Sometimes when all I'm doing is evaluating them, people say, even though this was just an interview, I really feel like I got something out of this. It's been so nice to be able to tell you my story. It's been so nice to feel like you're listening, or that you actually care and want to hear about the symptoms that I'm struggling with. And I chose anxiety disorders in particular because they are fascinating and they are so pervasive. A good 40% of people will have some sort of anxiety problems in their lifetime. And these problems can be crippling. They can be awful when people are struggling with them. And anything that we can do to come up with new and better treatments is something I want to be a part of.